Hi, my name is Dr. Graham McRary. I am a board-certified physical medicine and rehabilitation, specialized in interventional pain management physician here at EmergeOrtho. Trigger points are a common source of pain amongst our patient population. They come from hyper-irritable muscle, where essentially a muscle gets tight and taut throughout different regions. And when that happens, it essentially can refer pain not only at the source of the triggered muscle, but can even mimic things like nerve pain coming down the arm or down the leg, all from a really irritable triggered muscle. Cervical trigger points are triggered muscles, more commonly in the neck and a lot of times trap region. They also come down through the scapular area of the upper back. They commonly refer pain up into the back of the head, even up into the TMJ or the temporomandibular joint. Commonly they will also send pain into the shoulder and even sometimes down the arm. Trigger points are treatable by a number of different ways. A lot of times we use physical maneuvers to try and manually get that triggered muscle to release. Physical therapy does things such as dry needling, massage and cupping can be helpful to also try and increase blood flow and get that muscle to release. Injections are the next step in that line of treatment, where we place a small needle into that hyper-irritable, taut muscle. Use that needle to try and break up some of that spasm and tissue tightness, and then inject not only numbing medicine but a little bit of steroid to try and encourage that muscle to further release. There's no specific steroid that's perfect for any trigger point injection. Commonly we use Depomedrol, which is a classic particulate steroid. Other times we can use things like dexamethasone or betamethasone, each specifically tailored to potential side effects for patients. Trigger point injections ideally will last at least 3 months, providing at least 50% relief of that source of pain. Commonly we can see trigger points once they get released, if the patient is able to focus on stretching and other rehabilitation measures. Sometimes they don't come back when focusing on kind of an exercise regimen, stretching, and continuing massage to the area. Other times, trigger point injections can be repeated as often as every 3 months. So trigger points, although very commonly are in the neck, shoulder, and upper back region, can be present in any major muscle group, including down into the low back, thoracic region, are also other common sources of triggers.